My name is Amy Brenner, and I'm a board certified obstetrician gynecologist. I also have an extra board certification in functional and anti aging medicine. And today we're going to be talking about breast health. Breast health is really important to every woman. I think that's probably a big fear for most women is getting breast cancer, and rightfully so, because about 12% of women actually get breast cancer over the course of their lifetime. When a patient comes to our practice and wants to talk about breast health, it typically is divided into two categories. We have women who come in who don't have a problem at that time and want to talk about risk reduction strategies. On the other hand, we have many women who actually have a particular problem, such as a breast mass or breast lump. In that case, certainly a history of how long the lump has been present, characteristics of the lump. Is it painful? Is it movable? Is it hard? Certainly, a physical exam is important, and then imaging tests of either a diagnostic mammogram, ultrasound, and sometimes even an MRI. One thing that's important of assessing your risk of getting breast cancer is looking at your family history and do you have a gene that increases your risk of breast cancer? MyRisk is a test that we do for women who are candidates for genetic testing. They may have a family member that has had breast cancer at a young age, a family member who is a male that actually has breast cancer, or family members that have multiple cancers. Those women would be considered a candidate for MyRisk testing or looking at genes that could increase their risk, not just of breast cancer, but of ovarian cancer, pancreatic cancer, and colon cancer. The other things that are important that sometimes women aren't aware of are lifestyle factors of being at your ideal body weight. Your vitamin D status is really important to favor an environment that is toxic to cancer cells. Keeping your blood sugar under control is also very important. Reducing or eliminating alcohol consumption. Certainly, there are medications that can also increase the risk of breast cancer, such as synthetic progestins, unopposed estrogen. Sometimes birth control pills have been shown to do that, calcium channel blockers, and some other medications that have shown a slight increased risk as well. Breast self exams are something that's very important for women to do. I think it's important to start these at a young age so you actually get to know your breast and know what normal breast tissue feels like. So heaven forbid if there actually is a problem in the future that you know that there is a change in your breast tissue. So if you have concerns about your breast health, or even if you just want to have a consultation of what can you do to lower your risk of breast cancer, we'd love to see you for an individualized consultation.